Hello class, and welcome to your Chapter 5 lecture on how and why drugs work. So for today's lesson, the learning objectives will be that by the end, you should be able to describe the intended and unintended effects of drugs, explain the difference between potency and toxicity, describe the concept of a drug's margin of safety, identify and give examples of additive, antagonistic, and potentiative drug interactions, identify the pharmacokinetic factors that can influence the effects of drugs, cite the physiological and pathological factors that influence drug effects, explain the significance of the blood-brain barrier to psychoactive drugs, discuss the role of the liver in drug metabolism, describe the relationship among drug tolerance, withdrawal, rebound, physical dependence, and psychological dependence, and how they can affect drug abuse patterns. And finally, to explain the relationship of drug cravings to drug addiction and relapse. So when we start with the intended and unintended effects of drugs, we look at side effects. Side effects are the unintended effects that are caused by a drug. So these can include nausea and vomiting, changes in mental alertness, dependence, which also includes withdrawal, and withdrawal is simply an unpleasant effect that occurs when use of a drug is stopped. You can also have allergic reactions, changes in cardiovascular activity, and here's a chart here on the right that just shows the different side effects for the different organs depending on the drug that was taken. So it's important to know the possible side effects before taking a drug. Example, while morphine relieves pain, it also depresses breathing and can cause constipation. Amphetamines will suppress appetite for weight loss and also manages ADHD, but it can also increase blood pressure and stimulates the heart. So these are side effects that we don't necessarily want to receive from the drug, but there's the potential for them to be there. So now we need to understand the dose-response relationship of therapeutics and toxicity. So the correlation between the amount of a drug that's given and its effect is known as the dose response. The dose response curve will tell how a person is going to react to different doses of a drug. So the dose response curve can be determined for each individual person. Factors that will contribute to a variability in drug response includes the size of the person. Do they have any food in their stomach, and if so, what food is in their stomach? The time of day, the state of a person's health. Are they relatively healthy? Do they eat garbage? Do they eat a lot of fast food? The levels of enzymatic activity that are in the liver, so how healthy the liver is also. The acidity of urine, and tolerance. So tolerance is probably the biggest factor to know, and this results when the response to the same dose of a drug is reduced over time. So you build a tolerance in the sense that you've taken this X amount of a drug. Over time, you now require more of that drug to achieve the same effect. So margin of safety. Margin of safety is the doses necessary to cause an intended effect minus the toxic unintended effects. So it's the difference between these two. So the larger margin, the less likely that serious side effects are going to occur from that drug. So most effective drugs will have the potential to be dangerous with a high enough dose. So it's important to understand the margin of safety that we have with certain drugs. Then looking at potency versus toxicity. So potency expresses how much of a drug is necessary to cause an intended effect, while toxicity is the capacity of a drug to either upset or destroy normal body functions. So the smaller the dosage that's required to achieve the drug reaction, the greater the potency. So if you need a very small amount to achieve the intended effect, it's considered to be very potent. Potency also describes a drug's ability to have a therapeutic effect. So how potent is this drug toward reducing anxiety, towards reducing depression? Potency also is going to depend on the drug's absorption, distribution in the body, an individual's metabolism, the form of excretion, rate of elimination, and the activity at the site of action. Toxicity, on the other hand, may have a greater effect on a person whose body is already compromised by disease or illness. So drugs with a high potency are often toxic even in small doses. So it's very important to be careful of that. So we look at drug interactions. How do they interact with one another? Well, a drug interaction is when the presence of one drug alters the action of another drug. So when you have a cold, you may be taking pain relievers, decongestants, antihistamines, maybe anti-cough meds. So unusual effects can actually be misdiagnosed by doctors and lead to inappropriate treatment and serious health consequences. So interestingly, herb echinacea is often used to treat colds, can slow metabolism. So to counteract that, you could take caffeine. However, caffeine can also have side effects of jitters, headaches, and insomnia. So looking at additive interactions, this is the summation of effects of drugs when they're taken concurrently. So an example would be taking the same dose of Bayer and Tylenol would give the same pain relief that just taking 2 Bayer or 2 Tylenol would. While an antagonistic interaction or inhibitory interaction is when one drug is going to cancel or block the effects of another. So again, you could take caffeine to counteract drowsiness that's caused by antihistamines. And then potentiative interactions or synergism is when drugs' effects are enhanced by the presence of another. So when you're using maybe an opioid analgesic, taking alcohol on top of that would enhance the effects on the CNS or the central nervous system. So it's very important to be careful and to know drug interactions and to know what could interact with one another either positively or negatively. So one example is this last one here with alcohol. Alcohol is seen very often being used with other drugs that it shouldn't be used with, even birth control. You're told not to consume alcohol or large amounts of alcohol while you're taking it because of the possible drug interactions that could occur. So in dealing with these drug interactions, food and chemical pollutants can actually interfere or interact with drugs, not just two drugs with one another. Women are more vulnerable to drug interactions. And over-the-counter and herbal drugs can actually be just as likely to cause interactions as prescription drugs can. So simply because it's over-the-counter or simply because it's coming from a plant doesn't necessarily mean that it's any safer or that you have any less to worry about with the interactions that could occur. So when we look at pharmacokinetic factors that influence drug effects, we first need to define pharmacokinetics, which is the study of factors that influence the distribution and concentration of drugs in the body. So the first factor is administration. So how does the drug enter the body? How is it administered? The second is absorption. How does the drug move from the site of administration into the body system? Am I taking it orally? Is it then going through my digestive system? How does the drug move to various areas in the body or distribution? How and where does the drug produce its effects? Where is it activated? And finally, we look at elimination and biotransformation. So how is the drug inactivated? How is it metabolized? And how is it finally excreted from the body? So when we look at pharmacokinetics and drug testing, it's important to understand that, for example, Poppy seeds on just one bagel, on one poppy seed bagel, can actually lead to a positive test for opioid narcotics. So there are methods to mask or falsify drug tests also that can work. So there's certain liquids you can drink, certain other drugs that you can take that are supposed to counteract the drugs you've taken, so that if you take a drug test, it should come up negative for all substances. But this poppy seed I've actually seen happen in in juvenile probation. This juvenile had never used drugs and there was no history of drug use. So when the test popped up positive for opioid narcotics, I remember the PO saying, I don't understand how this could even be. So there was a lot of digging and a lot of research that was done to determine, the parents were like, well, did he eat something? We asked were they taking Tylenol or were they taking any other drug that maybe could have come up this way? So this is how we can link substance abuse and crime as well. It's important to know, one, who you're dealing with, who the offender is, what their history is, and three, to know how drugs interact with one another and how even foods can interact with drugs. So, pharmacokinetics and drug testing, when we look at this, pharmacokinetics can affect the ability and reliability of drug tests for the reasons I stated previously. So what are the different forms and methods of taking or administering a drug? We have oral ingestion, which is the most common. So it's important to also know that the method of taking the drug will affect how quickly that drug then enters the bloodstream and how it's being distributed on its action sites. So oral ingestion, with this method, it's difficult to control the amount that actually reaches the site of action because of three different factors. The drug first has to enter the bloodstream, passing through the wall of the stomach and the intestines. Then the blood must diffuse to the target area and remain there long enough to have an effect. Also, stomach contents can interfere with the effects of the drug. So if you've ever drank on an empty stomach or with little in your stomach, you know that the effects are much different and will come on much quicker than if you have food in your stomach for it to absorb it. Additionally, the liver may metabolize too rapidly before the effect is even seen. The second method is inhalation. So this is through either the mouth or the nose. And with this way, there's actually the potential for irritation to occur to the mucous membrane that lines the lungs, or the need to continuously inhale the drug to feel its effects. So vaping would be one example of this. We then have injection. So injection, the advantage of this is the speed of action and less of the drug is needed when we inject it. So unfortunately, when you use drugs intravenously and for extended periods of time, it actually injures the vein and will put it'll scar where you put the needle in. So that's why you'll notice those who abuse intravenous drugs or abuse drugs intravenously will have multiple spots around their body with these needle marks, and you can have abscesses grow because of the infection, because of the numerous times of putting the needle into that vein. There's also the concern that the vein could collapse from overuse. We also have intramuscular, which the concern here is contaminated needles and a spread of infectious diseases, also with intravenous use. And when we use subcutaneously, which just means under the skin, that it can actually damage that skin in that area. And then we have topical. So topical is where the drug is going to pass through the surface of the skin tissue to have its effects. An example of this would be a nicotine patch. Or you could even say the CBD oils or lotions that you could rub onto areas that have pain. That would be an example of a topical method of taking a drug. So here is just a chart, shows the different methods of administration, how quickly that drug will take effect, and for how long. So now we need to look at the distribution of drugs throughout the body, and the time-response relationships. So when distribution is affected, therapeutic effects can actually be diminished. So what factors affect distribution are the ability to pass across membranes and through tissue, the molecular size, its solubility properties, its tendency to attach to proteins and tissues throughout the body, and then the blood-brain barrier. So when we're discussing the blood-brain barrier, we have to understand that blood is carried to nerve cells of the brain in networks of capillaries. So drugs that are soluble in fatty solutions are more likely to pass across capillary membranes that are known as the blood-brain barrier. And this is a selective filtering between the cerebral blood vessels in the brain into the brain itself. So what's the required dose to achieve the effect that you want with a drug? Well, first we have the threshold dose, which is the smallest amount of a drug that's needed to elicit a response. The plateau effect refers to the maximum possible effect that can be achieved regardless of the dose. So a lot of over-the-counter medications will have limits on the effects. So you can keep taking as much as you want, but you're not going to continue to achieve a greater level of pain relief, say from Tylenol. So alcohol, when you have small doses of this, it actually makes a person more talkative and social, where when we have high doses of taking alcohol, it can actually cause drowsiness. So we then have time response factors. So time response factors can be acute, which means that they're immediate short-term effects after taking just one dose. For example, alcohol effects can be different depending on how much is consumed. But after one drink, you're typically going to peak at an hour, and then the effects are going to taper off. You can have chronic, which is long-term effects after repeated doses. So smoking nicotine causes long-term lung damage. And then cumulative effects. So this is a drug buildup due to short dosing intervals. So this is exemplified by binging drugs, especially ones such as methamphetamine or even alcohol. So our next stage is inactivation and elimination of drugs from the body. So the half-life of a drug is the time required for the body to either eliminate or metabolize half of a drug's dose. This is either directly without altering chemical composition or after being metabolized or modified. Biotransformation then is the process of changing the chemical or pharmacological properties of a drug by the process of metabolism. Metabolism allows the body to inactivate, detoxify, or excrete drugs. So the liver is the primary organ that metabolizes drugs. It actually contains enzymes that synthesize, modify, and deactivate the drug. Genetic variations will influence, though, the onset, duration, and potency of the drug's effects. The kidneys are then the second most primary organ. The kidneys remove metabolites and foreign substances from the body. So the rate of excretion can be altered by making the urine more acidic or alkaline. So this is used in emergency rooms to treat overdoses. An example is that nicotine and amphetamines are cleared faster from the system by making the urine more acidic. So elimination through perspiration and exhalation can also occur. So alcohol is metabolized partially through eliminating through your breath, through exhalation. So that's why we use breathalyzers to test for alcohol. And then metabolites are just the chemical products of metabolism. So here's a graphic to help you remember. The liver is the primary organ that metabolizes the drugs, and then the kidneys are what will then remove the metabolites or foreign substances from the body. So what other variables will modify a drug's effects? Well, psychological variables such as age. So younger children and the elderly will need smaller doses of drugs typically to achieve their effects. Gender, so body size, composition, and hormones will affect how that drug will affect the effects the person receives of that drug. Pregnancy, so added stress on the organs from simply being pregnant and the changes in physiology can increase the demand on the organs, making that individual more susceptible to the toxicity of some drugs. So there's teratogenic properties, which cause physical abnormalities in a fetus. So for example, alcohol and the effects that that has on a developing fetus. And then you have pathological variables, which are things such as diseases, having a compromised organ systems. So you have both physiological and pathological variables that are going to modify how the drug's effects. Now looking at adaptive processes and drug abuse. So drugs can alter the normal functioning of organ systems and can even cause death. So we look at dependence first, which dependence is simply changes or adaptations that occur as a result of frequent drug use. You can have physical dependence, which typically results in damaged social or personal skills, relationships, and impaired brain and motor functions. The rebound effect is a paradoxical effect that occurs when the drug is no longer present. So these symptoms are opposite that which are actually caused by the drug. For example, an alcoholic may be depressed while they're drinking, but then show signs of stimulation and hyperexcitation when they're not drinking. Cross-dependence refers to the ability to treat withdrawal symptoms with a different drug. So methadone is used to treat withdrawal from heroin. We then have psychological dependence. So this is an intense desire to consume a drug linked to cravings when the drug is not being used, and is the result simply of continued positive psychological reinforcement while the drug is being used. So it draws the user back to drug use and plays a big role in maintaining chronic drug use, cravings, that is. Tolerance is then the extent to which tolerance is built depends on the drug, the person taking the drug, how much of the drug they're taking, and the frequency that it's being administered. Reverse tolerance is an enhanced response to a drug dose. So it has the same effect or the same response to a lower dose than with the original higher dose. So it's reversed tolerance. You then have cross tolerance, which refers to developing a tolerance to a similar drug other than that which was consumed. So a tolerance to alcohol could lead to a tolerance in barbiturates, depressants, and anesthetics. Psychological factors. So looking at a person's mental set is extremely influential, also in the effect that the drug will have. So a mental set includes both psychological and environmental factors, such as unique qualities of an individual's personality, his or her past history with drugs and social experiences, attitudes toward the drug, expectations of that drug's effects, and motivation for using the drug. So this is how we can explain the placebo effect, which is psychological factors that influence responses to drugs independently of their pharmacological properties. So in a lot of testing, you'll have a placebo and the actual drug. So the placebo does not include the pharmacological properties that the actual drug does to test whether or not the drug is effective. But they're finding that simply thinking that you're taking the drug and that it's going to have the effect that you expect it to have can be enough to make even that placebo drug effective and to make that drug do what you think it's going to do. There's an article in this week's module you'll read on that. So what is the significance of dependence and becoming dependent on a drug when we're looking at addiction and abuse of drugs? Well, hereditary factors are very important to consider. So there's a genetic vulnerability with high-risk environments. So we see a greater similarity in rates of alcoholism if the alcohol abuse starts before the age of 20 in identical twins, more so than in fraternal twins, because identical twins have 100% of their genes in common. So it can show, as an example, how hereditary factors can play into dependence. Drug craving, which is the powerful, uncontrollable desire to use drugs during or after the withdrawal period. This is assessed by the intensity of drug use, physiological changes, as well as the tendency to relapse. It is arguably the principal cause of drug abuse and relapse after a person receives treatment. You can also have acute or chronic. So acute cravings occur when the drug is being used. You're craving it in the moment. Chronic cravings are, for an example, when an ex-user could be triggered by the environment that elicits a positive memory of the drug's effects. So say, for example, a person uses cocaine while they're at this specific bar with their friends. They haven't been to that bar in a while. They haven't used cocaine. They go back to that bar, and now all the environmental factors that are present in that bar are eliciting positive memories of when they used cocaine, and now they're craving it. Other factors can include things such as peer pressure, home, school, and work environments, feeling lonely or bullied, and even the media can all influence how dependent a person becomes on a drug that can lead to addiction and abuse. So, in sum, the intended effects of drugs are those that are expected to be seen, while unintended effects include negative side effects. There are numerous individual and drug factors that affect the way a person will respond to the drug. Potency is the dose necessary to cause the intended effect, while toxicity is the ability of a drug to upset or destroy normal body functions. The margin of safety is the difference between the dose necessary to cause the intended effect and the toxic unintended effects. Additive interactions occur when effects of two drugs are combined. Antagonistic effects occur when the effects of two drugs cancel each other out. Potentiative effects then occur when one drug enhances the effects of another drug. And pharmacokinetic factors include administration, absorption, distribution, biotransformation, and elimination. Physiological factors altering the responses to drugs can include age, gender, and pregnancy, while pathological factors include disease and a compromised organ system. Psychoactive drugs must pass through the blood-brain barrier in order to influence the brain and its actions. The liver is the primary organ that metabolizes drugs, making it then easier for the drug to be eliminated through the kidneys. Physical dependence is characterized by adaptive changes that occur in the body due to continued use, which causes tolerance. If drug use stops after physical dependence is created, a rebound response occurs, which effects are similar to that of withdrawal. Psychological dependence occurs because of the rewarding effects that are experienced with the drug use. And cravings are arguably the number one cause of drug dependence, drug abuse, and relapse. So this was your Chapter 5 lecture. I hope you have a wonderful week. And as always, if you have any questions, please feel free to reach out. I look forward to hearing from you.